Ethiopia. Amnesty urges government to negotiate with striking healthcare workers, free detained medics. Addis Ababa, Ethiopia, May 23, 2025. Amnesty International has called on the Ethiopian government to immediately engage in negotiations with striking healthcare workers, unconditionally release those detained for their involvement in the ongoing peaceful strike, and end the campaign of harassment and intimidation targeting medical professionals. The strike, now in its second week, has led to widespread disruption in healthcare delivery across the country, exacerbating an already strained system and limiting patients' access to essential medical services. With no resolution in sight, the government must not prolong a crisis that is jeopardizing lives and violating patients' right to health, said Tigray Haguda, Amnesty International's regional director for East and Southern Africa. Authorities must stop the crackdowns and instead enter constructive negotiations with healthcare workers to reach a fair resolution. An online network of medical professionals provided Amnesty with a list of 212 healthcare workers who have been arrested since the strike began on May 12. According to family members and legal representatives, the detainees were taken without explanation, and police reportedly conducted warrantless home searches, seizing electronic devices. Among the detainees is Dr. Malik Gwesh, a pathologist and outspoken advocate who had recently shared her views on working conditions in a BBC podcast. She is currently held incommunicado, along with at least 20 others at the Addis Ababa Police Commission headquarters, in defiance of court orders allowing family visitation. This heavy-handed response is not only unjustified but indicative of a disturbing trend in Ethiopia where dissent is met with arbitrary detention and intimidation, Haguda added. Medical professionals demanding better pay and safer conditions are being treated as criminals. Healthcare professionals in Ethiopia have long raised concerns about low pay. Some specialists earn as little as $80 per month, poor working conditions, and lack of institutional support. Despite ongoing appeals over the past 5 years, these concerns remain unaddressed. Compounding the crisis is the drop in health spending, which fell to just 2.85% of GDP in 2022, far below the 15% benchmark set by the Abuja Declaration. Amnesty International is urging the Ethiopian government to unconditionally release all healthcare workers detained in connection with the strike, cease harassment and arbitrary arrests of medical professionals, respect the right to peaceful assembly and free expression, allocate adequate resources to the health sector in line with its international human rights commitments. Instead of silencing voices calling for reform, the government must address the root causes of this crisis and ensure access to quality health care for all, said Haguda. The ongoing standoff highlights the urgent need for systemic change in Ethiopia's health sector, as well as a broader commitment to upholding civil liberties and the rights of workers.